Oftentimes, we hear that taking care of our mental health is important. But what exactly is mental health? According to the CDC, mental health consists of our psychological, emotional, and social well-being, which basically means the way we think, feel, behave, and interact with others. Mental health defines how we cope with the stresses we deal with from school, work, and relationships. Mental health is also connected to our physical health. Poor mental health or the presence of a mental illness may lead to a person developing a chronic illness, just as having a chronic illness can make someone more likely to develop a mental illness. Additionally, different lifestyle factors like exercise, diet, sleep, and smoking affect both our mental and physical health. So having good overall health means taking care of both our physical and mental health. Now that we have a basic definition of mental health and its importance, let's dive a little deeper into how it affects people. Mental health can be thought of as a continuum with two different axes according to American sociologist and psychologist Corey Keyes. The vertical axis ranges from good mental health to poor mental health, while the horizontal axis ranges from the absence of mental illness to the presence of mental illness. According to Keyes, having good mental health is known as flourishing, while having poor mental health is known as languishing. As seen in this diagram, it's possible to be free of any mental illness yet still have poor mental health and be classified in the languishing category, just as a person might have a mental illness but still maintain good mental health and flourish. How exactly does this work? A person with a mental illness may develop proper coping mechanisms or receive treatment that allows them to maintain good mental health. Conversely, a person without mental illness may still face overwhelming stress that is hard to cope with and develop poor mental health. So to recap, mental health is just as important as physical health and requires just as much care. Our mental health determines how we feel, think, behave, and interact with others and can be thought of as a continuum. A variety of factors affect our mental health and may even lead to the presence of mental illness, which will be discussed in later videos. Now for a quiz. Number 1. Mental health affects the way we think, feel, behave, or all of the above. The correct answer is D. Number 2, true or false? Having poor mental health is equivalent to having a mental illness. The correct answer is false. Number 3, true or false? Physical health is more important than mental health. The correct answer is false. Thank you for watching. If you enjoyed the video and found it informative, please consider liking and subscribing as well as sharing with friends and family.